Welcome to this presentation titled Sense of Belonging in College Students in Recovery, Implications for Recovery and for Student Success. My name is Christine Lancaster. I'm a graduating doctoral student in educational leadership. The focus of this research is to consider the implications of sense of belonging for the population of students who are in recovery from substance use disorders. Conclusions draw from my dissertation research on sense of belonging and its relationship with engagement, persistence, and intersectionality. Students in recovery from addiction are an important yet invisible student population. There is no accurate assessment to understand the number of students in recovery on today's campuses, yet substance use, abuse, and mental health data archive estimates that 250,000 college students received treatment for alcohol or other drug use in 2014. Studies show that supporting recovery influences college completion. Laudette, Harris, Kimball, Winters, and Moberg found that students who participate in collegiate recovery programs graduate at higher rates than the average completion rates for that person's institution. College completion provides opportunities for students as well as for their communities. Student persistence leads to an increase in economic, social, and health opportunities. For example, we are witnessing health disparities due to social economic status, education, and other factors unproportionately impact certain populations and communities during this COVID-19 crisis. Complex factors influence recovery from addiction, and complex factors influence student persistence. Sense of belonging is one of the complex factors that influence both. So, who are students in recovery? A student in recovery is a college student who has a substance use disorder and who is working daily to abstain from addictive substance or behavior. The Substance Abuse and Mental Health Services Administration define recovery as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Substance abuse is not limited to alcohol and drugs. According to Laudette, substance use and behavioral addiction can be related to alcoholism, drug addiction, eating disorders, sex addiction, self-harm injury, gaming, gambling, compulsive shopping, as well as other addictions. Watts, Chaudhry, and Holloway found pursuing education to be a critical goal in supporting recovery from substance use disorders or behavioral process addictions. Yet, college environments can be hostile to recovery. For people in recovery, relapse rates are estimated between 40 and 60% and is highest in the first 5 years of recovery. And post-secondary education poses additional risks. Messaging and college norms support alcohol and drug use, and this is added to the stresses inherent in being a college student. Cleveland, Harris, and Wiebe state challenging transitions from youth to adult can be especially challenging for students in recovery as they are compounded by the need to remain sober in an abstinence-hostile environment. This is where sense of belonging can make a difference for students in recovery. Sense of belonging can challenge norms, provide a recovery-safe environment, and provide opportunity for students in recovery to feel value and to feel fit. This may be especially important during times of transition, such as early recovery and or the college experience. So let's talk about what sense of belonging is. Maslow talked about sense of belonging in his hierarchy of needs. Belonging is necessary, according to Maslow, prior to esteem and self-actualization. In order to feel a sense of belonging, a person needs to feel that they are valued and that they have fit. Within the context of higher education, sense of belonging is a sense that one belongs socially and academically within the community of the post-secondary institution. Tyrell Strayhorn shows the model this way. An individual comes into the institution with their own identities, backgrounds, cultures, and experiences. The spaces and contexts of the college environment influence the student's actualization of needs, including belonging. Where a person lands with their sense of belonging has positive outcomes such as involvement, happiness, and college retention. For students in recovery, a positive outcome can be recovery. Negative outcomes include depression and health, and for students in recovery, a negative outcome would be relapse. As mentioned earlier, my dissertation was on sense of belonging and its relationship with engagement, persistence, and intersectionality. My research defined 4 dimensions of sense of belonging. They are identity. Do I see my identity reflected in faculty and staff? Discrimination. Are people like me discriminated against? Faculty and staff. Do I feel faculty and staff care about me and want to help me? Students and community. Do I feel like students respect me, care about me, and do I fit within this community? My research also found that we have an opportunity within our higher education environment to influence all 4 of these dimensions of belonging. Some substance use disorder is highly stigmatized. You may already have a picture in your mind when you think of the word addict. Further, refraining from alcohol as a college student may also invite judgment. Programs of support, such as collegiate recovery programs, have been found to break down the stigma of addiction and of abstaining from drugs and alcohol. In support of collegiate recovery programs, Schultz writes, substance use disorder is still heavily stigmatized. Students in recovery from substance use disorder desperately need to find community on campus. Living an abstinent lifestyle can often lead to isolation and little sense of belonging to their institution. He goes on to say, peer support and community are crucial in supporting students who are in recovery, normalizing recovery, and fighting stigma. My research shows that time with professors, engagement in activities related to the major or minor, and engagement in the community service relates to student sense of belonging with faculty and staff. Programs designed to engage students in recovery, programs for students in recovery related to these activities, can influence students' sense that they fit with the faculty and staff at this institution. The research also found 7 types of programs that influence sense of belonging with students in the community. Support programs, programs related to social justice, social activities, time with professors, engagement in community service, programs related to the student's field of study, and finally, tutoring and mentoring all connect students to their community and peers. There is a challenge, however, in reaching this population and providing the unique resources and opportunities so desperately needed due to the invisibility of the population and stigma of addiction. Dedicating a well-trained staff member to coordinate programs for students in recovery is necessary. Nationwide, colleges and universities are developing collegiate recovery programs. These programs follow defined standards to support an abstinence-based recovery within the institution that has a variety of recovery support services with a community of students in recovery and with dedicated physical space for students in recovery to gather. These standards relate directly to the 4 dimensions of sense of belonging I previously defined. They break down stigma, provide opportunity to see their identity in others, provide time with faculty and staff, normalize an abstinent lifestyle with peers and community, and provide a place for students in recovery to feel valued for who they are and to thrive within the college environment. More research is needed to fully understand the relationship between students in recovery and sense of belonging. My research also found that different populations define sense of belonging differently. So a question is, what does sense of belonging mean within the context of a college or university to this population? Quantitative studies can further assess what sense of belonging means to the population, and qualitative research can help answer the questions of why and how sense of belonging influences recovery and student success. Thank you for watching this presentation on sense of belonging and college students in recovery, implications for recovery and for student success. Please note references and resources. This is Christine Lancaster. Take care.